in Bloemfontein.
The Full Circle with Bridget Masinga, Monday to Friday, 1 to 3 p.m.
So in 2023, Vox had around 22% sick leave days that were taken by employees, and they wanted to find out a way of reducing that number without compromising on employee health. And they approach Guardian Eye for some kind of guidance and solution. And we thought today we'd catch up with Vox CEO Jacques du Toit and get a little understanding about, some of the findings and perhaps the measures that they implemented to help their organization with this and how it could be of benefit to you and yours. Good afternoon to you, Jacques. How are you doing today?
Hi there, Bridget. It's actually Rodney Talyor from Guardian Eye. We're the company that actually implemented the system for Jacques du Toit at Vox Telecom.
Apologies, Rodney. I've not gotten the updated rundown or guest as yet. Rodney Talyor from Guardian Eye. All right, let's get into it. So Vox had approached you last year, 2023, after noting 22% sick leave days undertaken by their employees. And I guess perhaps by way of just understanding, 22% is a significant amount of unplanned absenteeism?
It's a significant number. I mean, the total sick days was just over 2,200, and we reduced that down just to over 1,000 in 6 months. So it was a dramatic decrease, and it obviously benefited both the employer as well as the employee.
And did you have an understanding going into this fact-finding mission? What were perhaps the factors of the drivers towards this high number of absenteeism?
So I think it's not a Vox trend; it's a global trend where we're finding, globally, healthcare at the moment is under stress, if I can put it that way. The cost of healthcare is extremely high. The convenience factors is very low. And all in all, we are approaching healthcare very differently for corporates, where we're actually bringing the doctor to the site. But it's a virtual doctor using intelligent equipment that we're starting to deploy around the country at various corporate sites.
And maybe also, Rodney, just by way of us having a full understanding as to the Guardian Eye and the work and the technologies that you guys deploy for businesses.
Yes, so Guardian Eye is a technology business. So our entire focus is around healthcare of patients or staff members, and also safety of staff on site. So it's a 12-year-old business. But our biggest focus since COVID has been virtual healthcare. And this has been, COVID allowed us to actually build and design this product because the legislation changed during COVID where we could actually consult virtually with doctors with the virus. Nobody wanted to see a doctor or see a pharmacist or go near a clinic. So this product came out of COVID, and it's a product now that's being deployed globally, not just in South Africa.
And how did this, from what you sort of, your engagement with Vox, what were some of your observations and your findings, and of course, subsequently to that, the solutions that then came in handy?
Definitely. So the first thing we found, Vox, the actual access to healthcare. Many companies out there don't offer a medical aid or don't cover the medical aid. So from a cost factor, this was a product that Vox now provided for their staff at their cost, and the cost is radically low. I mean, it costs a patient 720 Rand for the year, which gives you unlimited access. I mean, these days, just one doctor consultation costs that. So it's unlimited access to our primary healthcare doctors was the first point, so costings. The second factor was a 24/7 service. So that allows them to access our doctors anytime, whether it's a weekend or or funny hours of the morning. And the third part that we did was we deployed digital medical equipment on site, which is extremely easy to use, and that equipment then does a self-diagnosis of the person when they're at the office. So we're getting actual live data of what the symptoms are of that person. So if I dumb it down, if a person had a sore ear, in the past, is it an ear infection or is it something that's moderate? With our equipment, we film the ear, and it takes 60 seconds on site. That video and information then goes through to our doctors, and they can do a proper diagnosis, what the concern or what the symptom is of that ear, and then give a diagnosis. And that person is booked off for the correct amount of time with the correct prescription given to them.
I see. Very handy. And how do employees take to sort of these kinds of advances? Because then some would go, yeah, well, I kind of want to take my time off, and I'm entitled to my sick leave, whether I'm feeling, moderately sick or severely ill. I want to be able to take leave and not come into work.
So from an employee perspective, what we find at Vox is the system ran for a certain period, and obviously the numbers spoke for themselves. And when we removed the system, the employees actually asked for it back.
Oh.
So we found there was a big buy-in from the employees because there's the 80-20 rule, I guess. The 80% of the employees want primary health care on site at a very low cost and very convenient. So it benefited both the employer as well as the employer.
Yeah. And this also speaks to, I guess, a lot of sort of the conundrum that a lot of people face, right? In that people want to, and in most instances need to be at work. They need to be earning the salary and would rather opt to be at work than to take time off.
Definitely. And also, in today's working environment, often, you're working in teams. So if somebody is not present, it affects the entire team, which obviously disrupts productivity. So when we looked into the Bradford theory, when staff are off more regularly, it disrupts the team. So if a staff member is off once a day every week, that's the person being off for 3 days in 1 week. The company feels that effect, and that's what we found by deploying AVA. We can catch the symptoms early. That staff member is not off regularly. He can rather take his leave, which he needs 3 or 4 days to rest, and then that person is bright and healthy and well. And also then that person comes back to work and doesn't spread possibly those symptoms that they had.
AVA being the system?
AVA is the system. Yes, so AVA means life in Hebrew. So it's just the name of the product, but it's a mobile app that gets downloaded onto your phone. And as I said, you've got 24/7 access to our primary health care.
All right. So once one downloads, if employer then sort of subscribes into your program, once one downloads AVA, is it an easy interface for employees?
Extremely easy. It's been designed for anybody to utilize. A lot of our users are more of your blue collar trade, so it's a very, very simple app to use, and also it stores all of your information digitally. So now you've got a digital record on your phone at all times, and it's obviously fully POPI compliant. It's a consultation between the staff member and our doctor. The employee is not in the middle, and that information stays between the doctor and the patient.
It all sounds very convenient, especially when you talk around the cost effectiveness, the cost effective access to healthcare, which we know in South Africa, those numbers run quite exorbitantly high.
Extremely high. And we are here to disrupt. It's very similar to what I refer to companies like OutSurance did in the 90s, where we are now disrupting the cost of this primary healthcare and going directly to the end user, being the company that's employing the staff member, and cutting out a lot of steps along the way.
Yeah, and something that for employers seeking to sort of utilize a system like this, I'd presume it's quite also on their end, it's quite an easy thing to sort of integrate into the processes and systems of their respective organizations, no matter how big or how small.
Extremely easy, and as I was saying, there's a couple of options. One option is that we actually put a permanent person on site that actually manages the equipment and manages the staff's expectations. That's for your larger corporates, but we can literally train up a person like we're busy doing with some private schools around the country, which I don't want to mention the names, but it's some big brand schools around the country. And those schools, we train up the person that's on site, that's possibly in your sick bay area of your school, It's a one-day training course that they go on. So there's very, very little boundary to market with type of product and technology.
Oh, you see, now I never thought about, the use of technologies like this in a schooling setting.
Definitely. And we presented to the Gauteng Education on Friday in one of the regions. And I mean, the uptake was very good. To put a product like this to help, your government schools. This is not just focused at your private schools. This is focused also for your government. And I see this tying in possibly with the NHI later down the line.
And as you say, I mean, well, at least from what I'm gathering, this sort of takes quite the huge strain off an already overburdened health system. If we can give you quick, easy, effective access to services 24/7, what else can one possibly want?
100%. There's other modules that we're working on. Like there's a wellness module. So we're finding, especially in India, I mean, there's a big growing concern with children, children's wellness in the Indian schools. So there'll be a wellness component to our product, as well as an occupational certificate sign-off for your big manufacturing plant. So we are saying we're taking healthcare to the next level virtually on site at an extremely low price.
Yeah. Sounds very interesting indeed, and I think ultimately also from a professional setting, helping companies and industry save money, because the productivity or the loss of productivity, the lack of human capacity on any given day, if things are stalling, it means you're hemorrhaging money with every single day that Bridget is off sick.
Correct, and with this technology, you can measure it now. In the past, you get a medical insurance or a medical aid. You're not really able to measure the effect that's actually having in your productivity. This is a tool. It's a productivity tool as well as a primary healthcare and wellness tool for the company.
Yeah. Rodney, thank you so much for all the information. That was Rodney Talyor, and he is, of course, the director out at Guardian Eye. By the way, Rodney, for anybody that might have an interest in exploring a conversation with you around AVA, the simplest way to get in contact with your team?
The best way is just to go through our website. So it's guardianeye.co.za, and on there you're able to book a demo. And one of our consultants will do either a virtual demo for the HR manager or the company representative, or our sales team around the country can come out on site and show you exactly how the equipment works.
Lovely. That was Rodney Talyor with Guardian Eye. And of course, as you heard, guardianeye.co.za is where you can go if you are interested. And there's some follow-through tabs there for you or for your HR manager in order to book the necessary consultation. And you see how AVA works and whether or not it would be a good fit for you and your organization. It speaks to, cost-effective access to healthcare, and also providing you with 24/7 access to medical health practitioners with that easy interface that you just download onto your phone for all your employees. And of course, as you heard Rodney saying as well, that there's digital medical equipment on site, as well as a physical, tangible individual also on site, depending on the needs of your organization and your school, if it's something that you think would be quite useful for your school. You just you never know. On the other side of 2:30